Welcome to the deep dive. So imagine trying to learn, well, everything about surgery. It's just this vast, complex, incredibly detailed field. Getting things right literally saves lives. How do you even start to navigate that huge amount of knowledge?
It's a massive challenge, isn't it?
Right.
For anyone entering that world or even practicing in it, finding a clear path through all that information is just crucial.
Right.
So our mission today really is to unpack one specific resource, a guide you could say, and try to understand not just what it covers, but why its specific approach might actually work for mastering something so demanding.
Exactly. We're diving into a description we found in the book 100 Questions and Answers in Surgery for Medical Students by Dr. Atef Ahmed. We want to pull out the core insights. How is this thing built? How does it function as a tool in that huge learning journey?
And what's interesting is the description makes it clear it's not only for students. It's also positioned as valuable for residents who are deep in their training, and even for practicing surgeons, maybe looking for a quick, reliable refresher.
So it really spans different career stages.
Yeah, multiple stages of surgical career.
Okay. So let's really dig into what this book actually is and how it's structured. Because the format, well, it's called out immediately as a key feature.
It is. It's built entirely around a question and answer format, a Q&A.
And they highlight this Q&A structure, calling it an interactive learning experience.
Right. The idea seems to be that it actively challenges readers to test and expand their knowledge. It's not passive.
That's interesting. It implies you're not meant to just, read it straight through like a novel or even a standard textbook. It's designed to make you stop, think, maybe recall information before you see the answer.
And the description also notes this makes it easy to navigate.
Ah, okay.
Sort of modular, maybe, and ideal for study sessions and quick reviews.
You can totally picture someone grabbing this for like 15 minutes before rounds, can't you?
Exactly. And, well, that points to a key insight, I think, about why this format might suit a field like surgery.
How so?
Well, instead of just laying out facts, the Q&A forces active recall. It kind of simulates being put on the spot, right? Being asked a question and needing to come up with the answer.
Okay, yeah.
Which isn't just memorization. It's practicing pulling that information out under pressure. And that's pretty fundamental to clinical practice, especially in surgery.
Right, you need it fast.
It directly targets that ability to access knowledge when you need it, quickly.
Okay. So speaking of the knowledge itself, the description uses this phrase, vast spectrum, to talk about the content. Apparently, it covers everything from basic fundamentals right up to the most intricate procedures.
Yeah, the scope does sound incredibly broad. It says it covers essential principles and practices, and then it lists specifics.
Like what?
Surgical anatomy, physiology, pathology, oncology, trauma, emergencies, complications, outcomes.
Wow, okay. And it keeps going. I think I saw techniques, specialties, instruments, equipment, innovations, advancements.
Yeah, even the sort of professional side.
Yeah.
Education, training, residency, practice, certification, guidelines.
My head's spinning just thinking about covering all that in only 100 questions. How does that work?
Well, that raises a really interesting point, doesn't it? If it covers that much ground in just 100 questions, what does that suggest about the level of detail?
Right.
Now, the source does emphasize that each question comes with detailed explanations and insights.
Okay.
It claims this provides a deeper understanding, helps reinforce key concepts, and specifically aims to bridge the gap between theory and clinical application.
Okay, that last bit sounds crucial. Bridging theory and practice is absolutely non-negotiable in surgery, right?
Totally.
You can know all the facts in the world, but if you don't know how they apply in a real patient situation, well, it's useless.
Exactly.
So the promise here is that the answers aren't just the what, but they give you the why and the how in a clinical context.
Precisely. And the source connects the quality of that connection directly to the author, Dr. Atef Ahmed.
Yeah.
He's described as renowned, a seasoned surgeon and educator.
So not just an academic writing about surgery, but someone who's actually, done it, been in the OR, taught people how to do it.
Exactly that. His extensive experience is specifically highlighted as the factor ensuring the content is clinically relevant.
Okay.
And that it prepares readers for real-world scenarios.
That kind of practical grounding from an expert, that must be invaluable.
Well, yeah, because it likely shapes which 100 questions get picked as the most important ones.
Good point.
And how the answers are framed, focusing on what you actually need to know when you're faced with a patient, not just some textbook trivia.
Makes sense. And in a field that moves as fast as surgery does,
Hmm.
things change constantly.
Right. The source adds that the book incorporates the latest surgical techniques and guidelines.
Which is critical.
Absolutely vital. Outdated information in surgery isn't just wrong. It can be dangerous. So relying on a resource that specifically says it's current, that's important.
It suggests the book isn't just a snapshot in time, but it tries to keep up.
Yeah, attempts to evolve with the field. Essential for staying relevant.
Okay, so we've kind of unpacked the format, the huge scope, the promised depth, the author's credentials, the currency. But what about people who've actually used it? Does the description mention reviews?
It does, yeah. It references customer reviews, and the feedback seems pretty positive, actually. It tends to reinforce the claims made.
Like what?
Well, some reviews call it an invaluable resource for mastering surgical concepts.
Invaluable. Okay.
And another labels it a must-have for any medical student's library.
High praise. Anything about that clinical connection we talked about?
Yep. One review specifically mentioned it was instrumental in my surgical rotations.
Ah, okay. So that speaks directly to that bridging theory and practice idea.
Exactly. And the Q&A format itself gets specific praise, too. People say it makes learning complex surgical topics accessible and engaging.
Accessible and engaging, complex topics. That's quite a combination.
It is. And they also like the explanations, calling them clear, concise, and extremely informative.
So it sounds like the key features, the description highlights, really do resonate with the users.
Okay, so let's connect this all back to you, the listener, especially if you're facing the challenge of mastering some dense, complex, high-stakes field. Maybe it's surgery, maybe it's something else entirely. How does a resource like this, built around active Q&A, covering a huge scope but promising clinical detail, written by an expert practitioner, aiming for currency, how does that function differently from just, say, reading a textbook cover to cover?
Well, you could think of it as a kind of highly focused practical filter.
Okay.
Instead of just presenting all the information linearly, it tries to anticipate the key questions you're likely to face, whether that's in exams or, in the clinic.
It forces you to engage, to practice recalling the info, and then immediately gives you the clinically grounded answer. It seems designed for efficient, targeted learning and quick review.
Focusing on information density.
And the practical angles that an expert thinks are essential, which is exactly what you need when time is tight and the stakes are, well, really high.
So this deep dive, it's really shown us how this one specific resource, 100 questions and answers in surgery, is put together to try and tackle that huge challenge of learning surgery.
Yeah, it's built on that interactive Q&A format. It aims to cover a massive range: fundamentals, clinical application, even professional life stuff.
All filtered through the lens of an experienced surgeon and educator.
And kept, supposedly, up to date with the latest guidelines. It's positioned as a tool for efficient, clinically relevant learning.
Designed to help you not just know the facts, but really connect theory to what happens in the real world.
And useful for learners at different points in their surgical journey, from student to practitioner.
So, here's something to think about. In a field as dynamic, as demanding as surgery, where quick recall and practical application are just paramount, what does the effectiveness and popularity of a resource built around just 100 questions and answers tell us? What does that suggest about the fundamental ways our brains might best internalize complex, high-stakes knowledge so it's ready when we need it?
Is that act of asking and answering, curated by an expert, maybe the ultimate shortcut to practical mastery in a field that just never stops changing?
Something to consider.